Every 3.5 minutes, a life is lost to a stroke in the United States. That adds up to an average of 400 deaths every single day, making it a leading cause of long-term disability. But here is the most important thing you need to know. A stroke does not have to be a death sentence. In fact, recognizing the signs and acting immediately can be the difference between a full recovery and a tragic outcome. A stroke, often called a brain attack, occurs when a blood vessel in the brain either bursts or becomes blocked. This usually falls into two categories: ischemic, which is a blockage that stops blood flow, or hemorrhagic, which involves bleeding within the brain. While many people think this only affects the elderly, 30% of people under the age of 45 actually cannot identify the warning signs. To make sure you're prepared, just remember the acronym Be Fast. Start with B for balance. Watch for a sudden loss of coordination or trouble walking. E is for eyes. Look for blurred vision or a sudden loss of sight in one or both eyes. Then check the face. Look for drooping on one side or ask the person to smile to see if it's uneven. A stands for arms. Check for weakness or numbness. If they try to raise both arms, does one drift downward? S is for speech. Listen for slurring or confusion. You can ask them to repeat a simple sentence like, "The grass is green," to see if they struggle. Finally, T stands for time. If you notice even one of these signs, do not hesitate. Call 911 immediately. While some stroke treatments can be administered up to 24 hours after symptoms begin, they are significantly more effective the sooner they are started. Every minute that passes without blood flow means more brain cells are at risk. When you speak to emergency services, tell them exactly when the symptoms started or the last time the person appeared normal. And most importantly, never attempt to drive a stroke patient to the hospital yourself. Paramedics have the tools to begin treatment the moment they arrive, and they can relay critical data to the hospital so the medical team is ready the second you pull up. Now that you know the signs, remember to be fast. You might just save a life today.